Time she's had relief in that hand in months since,
she's doing very well.
Yeah, she certainly is. Okay, now let's get to the car accidents, okay? Because I would think whiplash is the number one, which is a neck injury, right? And so let's talk a little bit about what you do for that, and sometimes it doesn't show up right away.
Very commonly, I mean, what's the first thing that happens to you after you have a car accident? Well, you're more worried about the car than you are about yourself. You're thinking, well, how am I going to fix the car? How am I going to get driving again? And you really stop thinking about all those things that could have happened to yourself. If your car is damaged, there's a very good possibility you're going to have injuries in your spine, in your neck, in your low back. And very commonly, you might just have a little bit of a pain and you think to yourself, well, this will go away, or at the hospital, they told me there's really nothing wrong, to follow up with my doctor. And very commonly, a year later, several months later, you'll start to experience pain in your neck, pain in your back, and you think to yourself, I don't know how I got these injuries. And very commonly, it can be associated to a previous accident that you had several months before, sometimes even several years before. And that's why it's so important to really get those injuries checked out as soon as possible.
Right. So you can detect it right away if you've had an accident in the last week or two, or even a couple of days.
Well, you can.
Well, if you have obvious pain, obviously you're going to go right to the doctor. But if it clears up, then all of a sudden you have something a little bit later on, then you should come and see you.
Well, that's why it's so important to go to a doctor who specializes in injuries from auto accidents, because very commonly, as I said, after you get into an accident, a lot of times a doctor, what they'll make sure you're not going to drop dead in 24 hours, make sure you don't have a serious injury where you're going to have to end up in the hospital again. They really don't look for, a lot of times, those little subtle injuries, like from a whiplash you could have damage to the muscles, damage to the ligaments, where over time it'll start to develop into a degenerative arthritis. And these days there are advanced tests that we use that can catch these types of injuries. We can catch them ahead of time so you don't have to worry about the problem coming about later, because it's a lot easier to fix early than it is later on. And of course we're notorious for waiting when you have an injury to fix it.
Right, because you say, well, it'll take care of itself, or you may not even notice it, and then the pain may show up someplace else.
Yeah.
Right, in a leg, or like in Marianne's case here. Of course, she didn't have a car accident. We don't know what caused it, but the problem is actually in the neck, right?
Yeah,
so,
and chances are it probably occurred from something that she had in the past. There could have been some type of repetitive stress injury that she had, and if her doctor at that time would have done the special testing, there are special diagnostic tests that we can do to determine if these types of injuries, first of all, if you have these, and if it's going to develop into a degenerative condition later on, such as degenerative arthritis, a disc herniation, sometimes even fibromyalgia. So all of these things can be associated to injuries that you've had previously. So it's so important to check for these injuries.
Is there any kind of a cream or an ointment that can give some temporary relief while you're working on it to get rid of it entirely?
Yeah, of course there are different types of temporary things, and just like I gave to Marianne, we gave her some BioFreeze, which is something that she can use to eliminate some of the pain while she's going through the treatment. So absolutely, there are different things that you can use.
Well, the BioFreeze works. I know that because a lot of them are just hype. I mean, you put the creams on and they